For the last decade, I've been mainly centered on airway-centered treatments. Now, so that kind of delves into a few different areas. First of all, early intervention orthodontics, but also adult orthodontics as well. And then also into sleep apnea, SDB treatments, and TMD treatments, which is kind of an untapped sort of market in dentistry in modern times, I'd say. The most obvious way to use a laser is for trigger points. So trigger points are areas of raised, palpable nodules of muscle that are usually pretty irritable. They're quite painful for the patient. And the laser does a great job of deactivating these trigger points, simulating healing, but also within seconds to provide a really profound analgesic effect. So to reduce pain in these patients in a matter of seconds has been, I think, the most amazing thing about this treatment. But something that we're using the laser for, which is perhaps a departure from the norm, is to deactivate the muscles responsible for the condyle to be placed in a posterior and superior position. So with TMJ problems, the condyle is usually not in the right spot. But we're kind of looking beyond just treating the condylar position and treating the cause of that incorrect condylar position, which is usually swallowing with muscles of facial expression around the mouth and the rest of the face. So we're actually using the laser to deactivate those muscles of facial expression as well. We've been using the muscles to treat malocclusion for a long time. And when you look at malocclusion, you realize malocclusion is actually related to TMD. It's also related to sleep apnea and SDB as well. It's really all part of the same syndrome that has the same etiological factor, which is the way the muscles behave. When you look at TMD treatment, you realize that these are actually all orthodontic cases. So the best way to treat TMD is actually to get a time machine, go back in time and treat them orthodontically when they're still in the growing phase. There is a lot we can do when they reach adulthood, obviously, with a combination of oral appliances, some orthodontics, and the laser to give them that profound analgesic effect. But I think using the laser in kids is actually even better than using it in adults. It basically relates to treating the way the muscles behave. So in terms of the way the muscles should behave, at rest, your tongue should be in the palate, your lips should be together, your teeth should be slightly apart. If you don't have those things happening, then you will be recruiting your muscles of facial expression to swallow. And if these muscles of facial expression are activating during a swallow, it holds back proper craniofacial development. So by retraining the muscles, by using orthodontic appliances, and now by using the laser, we can work to deactivate those muscles of facial expression to promote better craniofacial development. And I think that application is not really being used by anyone else. I think with anyone who's a dentist, you get an instrument, and when you apply an instrument to tissue, you want to see something being drilled. You want to see blood being produced. You want to at least see some form of redness when you take an instrument to tissue. But when I was told by you that they don't feel any pain, you don't see any redness, I thought it was complete voodoo. I thought this must be a gimmick. But what was really surprising to me is that the damn thing actually works. So you apply the laser to a trigger point, and what was amazing is that within literally 90 seconds, you can deactivate a trigger point. And that instills a profound confidence in whatever treatment you're doing. If you can get them out of the pain within seconds, when their primary complaint is pain, whether you like it or not, you've got a patient for life. I've been using it for the last year, and I can honestly say that there hasn't been one patient who hasn't responded to the laser, which is amazing to me. I mean, 100% strike rate is unheard of in dentistry or medicine. Yes, there are some patients where you need to spend a little bit more time with deactivating their trigger points when they're really chronic patients. But 100% strike rate is pretty amazing. So it can fit any profile of patient. And we've treated minor TMD patients to patients with severe condylar resorption. And there's one patient in particular, a 28-year-old woman who came in, and she'd been to an orthopedic surgeon before. She had a CT scan done, and she had significant resorption of her left mandibular condyle. Within 6 months of using oral appliances and TMJ related exercises plus the laser, she's had almost complete condylar regeneration, which is nothing short of amazing. Usually when you confront them with the laser, they've been to everyone before. So they've had acupuncture done, they've been to osteopaths, chiros, physios. You present them with the laser, and they're usually as skeptical as I was when I was first confronted with the laser. They ask, will I feel tingling? Will I feel any pain? Because usually with massage, for example, they will definitely feel a lot of pain when their trigger points are being deactivated. So again, when you tell them, you really normally feel nothing. They're completely incredulous. So I palpate a trigger point, point and shoot with the laser. 90 seconds later, palpate the trigger point again, and they're a believer. Praise the Lord. So within 90 seconds, you can instill complete confidence in your treatment, no matter what your treatment is, with just laser alone. So you can really build your TMJ treatment plan, no matter what it is, around the laser. Use the laser at the first appointment to instill confidence, and then after that, we use the laser at every single appointment for its analgesic effect and also for its therapeutic effect. But their reaction is amazement. Obviously, it reduces inflammation, so it reduces the pain, but it also works at a cellular level. And by working at a cellular level, it stimulates healing. So we really think that the condylar regeneration that we're getting especially is heavily influenced by the laser therapy we're doing at every appointment. There's a lot of different applications when it comes to lasers. You've got, traditionally in dentistry, we've used cutting lasers, especially for soft tissues. But with this, it's a low-level, light laser, and the way it works is by regulating cellular metabolism. So, number one, it increases levels of what's called protein phosphatase 1, and that is quite important, amongst other things, to regulate contraction and relaxation of muscles. Secondly, it also helps with glycogen metabolism, and that's the important energy source for muscles. So in both those ways, at a cellular level, it actually stimulates healing, which is pretty amazing to me. In dentistry, we have Neanderthal brains. We take instruments to tissues that actually have an observable, palpable effect. We see, if we're treating a condition, we see tissue being removed, we see bleeding, we see redness, we at the very least, inflict some pain on the patient. With this, it's almost like magic. You hit them with the laser, they feel nothing, and then afterwards you palpate a trigger point, and in most cases it's actually completely gone. You can't even palpate that trigger point anymore. So that surprised me most.